Hi, my name is Leah Archer. I'm one of the co-founders of Aphasia Relearned, and I'm a physical therapist. I have my doctorate degree in physical therapy from the University of Puget Sound in Tacoma. I want to talk to you guys about neuroplasticity, and it's kind of what we're basing our underlying mission on. So neuroplasticity, you may have heard of it as behavioral cognitive therapy when people want to change a bad habit. It's rewiring of the brain. So when a person has a stroke, part of their brain is damaged. Then they have an outer area that is somewhat damaged or bruised, and then the rest of the tissue is normal tissue. Neuroplasticity is when we take that bruised area and the brain creates new pathways. It creates new synapses and a new map. So with aphasia, people have aphasia because the side of their, or the part of their brain that controls speech, be it Wernicke's aphasia or Broca's aphasia, which is what Kent has, is damaged. And the words are there, but they have a hard time coming out. So neuroplasticity, which would be creating a new pathway coming around that damaged area and new pathway through the bruised area so that he can develop a new speech roadway. One of the things that we talk about is that it's like he is having to travel along a dirt road, the back roads with potholes, where he used to have an interstate from his words to his mouth. So he is forming a new roadway, and as time goes on, that roadway continues to improve. There's research out there that shows that neuroplasticity is forever. It used to be believed that neuroplasticity or recovery from stroke was in the first 2 to 6 months, which I believe is what Kent was told after his stroke. But the data is out there that shows that neuroplasticity can happen even at 10 years post-injury and probably forever. Neuroplasticity works just like physical therapy works, in that if you provide a stimulus, then your body and your brain will meet that stimulus and grow. For example, if we were to do a bicep curl and we always stuck with 3 pounds, we would never get stronger than that 3-pound bicep curl. But if we're continuing to do it repetitively, frequently, and then we increase our weight, then we would get stronger over time. So with neuroplasticity, if we provide that stimulus, we provide that demand to the brain, then the brain has the ability to change. And so it's really exciting. We've seen what Kent has done from his initial stroke to where he is now, and having that demand, that one-on-one comprehensive speech therapy for aphasia, and how he can now speak so much better, and he's continuing to improve. He goes to ICAP programs and they place that demand on him. And our hope is that we are able to build a foundation, a nonprofit organization, so we can take people and send them, no matter where they are in their recovery process, to an ICAP program so that they can relearn and gain some independence through their speech.